generally is helpful to remember duration of exposure, quantity of virus, plus immune system state are the important variables for infectious diseases. The main sources for COVID-19 infection are home, workplace, public transport and social gatherings, and restaurants. This accounts for 90% of all transmission events. In contrast, outbreaks spread from shopping appear to be responsible for a small percentage of traced infections. Ignoring for a second the terrible outbreaks in nursing homes, we find that the biggest outbreaks are in prisons, religious ceremonies, and workplaces, such as meatpacking facilities and call centers. Any environment that is enclosed with poor air circulation and a high density of people spells trouble. Importantly, of the countries performing contact tracing properly, less than 0.3% of traced infections have been reported from an outdoor environment. This statistic is from a study of more than 7,300 cases in China. One can see from the associated section on the website shown at the end of this video how being 6 feet away from an infected person with COVID-19 will likely work in many outdoor cases, but may not protect you in a relatively small space with recirculating air. Even though a study in March 2020 demonstrated that COVID-19 viral RNA can be found on surfaces up to 3 days after exposure, scientists commenting on these studies said the virus on these surfaces might degrade more quickly. The Centers for Disease Control and Prevention has since March said that contaminated surfaces are not thought to be the main way the virus spreads. The main driver of infection is thought to be directly inhaling droplets released when an infected person sneezes, coughs, sings, or talks. The CDC recently made changes to its website to make this message even more explicit. Much of the information cited I just cited, comes from an article by Erwin Bromwich, PhD, Associate Professor of Biology at the University of Massachusetts, Dartmouth. I think outdoors is so much better than indoors in almost all cases, said Lindsay Marr, an engineering professor and aerosol scientist at Virginia Tech. There's so much dilution that happens outdoors. As long as you're staying at least 6 feet apart, I think the risk is very low. The virus load is important, said Eugene Chodnovsky, a physicist at Lehman College and the City University of New York's Graduate Center. A single virus will not make anyone sick. It will be immediately destroyed by the immune system. The belief is that one needs a few hundred to a few thousand of SARS-CoV-2, that's same as COVID-19, viruses to overwhelm the immune system. Air pollution and COVID-19 health risks. Air pollution includes not only industrial, agriculture, car and truck driving pollution, Also included is fireplace and other wood and coal and charcoal burning. One recent study found that even small increases in fine particulate matter, known as PM 2.5, had an outsized effect in the U.S. An increase of just 1 microgram per cubic meter corresponds to a 15% increase in COVID-19 deaths, according to researchers at Harvard University, T.H. Chan School of Public Health. The picture of the website coming up has all the information on any of these series of videos, plus much more, and the science reference. The web page can be found on the website bigagbigchem.org by clicking on the bold link in red in the middle of the page labeled Information on COVID-19 not easily available to the public. It's shown in the picture you're looking at.